Welcome to the Aspen Institute's Murdock Mind, Body, Spirit series event featuring Dr. David Agus in conversation with Dr. Jessica Herstein. I'm Crystal Logan, Vice President of Aspen Community Programs here at the Aspen Institute. And I first want to give a special thanks to Jerry and Gina Murdock for making this series possible. Thanks to our audience for joining us today for this important conversation. As I introduce our guests, you'll find links to their full bios in the chat, as well as other important information throughout the event. If you have questions for Dr. Agus, you can type those into the Q&A feature anytime throughout the event. Dr. David Agus is CEO of the Ellison Institute at the University of Southern California and an author of several best-selling books. He has offered to our audience today access to his text service, which is fantastic. You can text "Sign Me Up" to the number that you'll find in the chat. You'll receive updates from Dr. Agus on COVID and eventually other health matters. You can also text him directly and receive direct responses. So that's amazing. That number is 310-299-9322. Dr. Jessica Herstein specializes in preventive medicine, internal medicine, and occupational and environmental health. We're thrilled and honored to feature you both here today. So with that, I will turn it over to you, Jessica. Thank you. I think you're on mute, Jessica. There.
Am I good now? Good evening, and thank you, Crystal, and thank you to Jerry and Gina Murdock also. I'm sorry we can't be in Greenwald Auditorium or Pepke tonight, but we'll have a very interesting discussion nonetheless. When you read The Lucky Years, you'll see that the author is talking to you. And it's a terrific, understandable, intriguing conversation, albeit one way, where he tells stories and he describes pivotal studies that preview the scientific advances that David says, and he's always optimistic. He says they're transforming our ability to be in greater control of our health as we age. He tells us specific experiments that have marked the scientific discovery process and how that is playing out for prevention and treatment, and he includes perspective from some of his oncology patients. It turns out that there is precedent in nature for health not declining as you age, interesting, and we can hope to control or maybe even reverse our aging. Our future includes targeting the molecular changes in our own cells to prevent the cancer that we're at high risk for, or treat the cancer that we have so we don't die from it. Stem cell research is one of the most promising areas, it sounds like. So David, technological advances are key to our future living longer and healthier lives, especially the capacity to tailor to the individual. So what is personalized medicine or precision medicine, and why are you so enthusiastic about it?
You know, throughout history, we've treated everyone the same, and we bucketized disease, which is a funny word, but we've done that. Cancer is based on body parts, a remnant of the 1800s in Germany: breast, lung, prostate, brain. And we can now say, what are the on and the off switches? And we could subcategorize disease so we can actually target the root cause and give the right drug and the right dose and the right patient at the right time, which is something we dreamed of before. You know, technology really has enabled that, and it's become commonplace. You know, Jerry and Gina changed my life a decade ago, where they introduced me to Murray Gelman at Aspen. And Murray, you know, a physicist, one of the greatest brains of our generation, showed me how we in the body are a complex emergent system. And what's amazing about complex emergent systems is it's very hard to understand, yet you can control them. So the whole notion of what he called coarse graining, you know, looking at the shape of the cloud, not measuring every variable to predict the weather, and doing the same thing in human biology. You know, when you were sick, your mother went like this. She didn't measure your T cells and your cytokine levels. She knew right away you were sick, probably more accurately Then if you got reductionists and look at 100,000 variables, she knew right away. And so that power really has enabled a new era in medicine, which is using ideas like that to really personalize care in a dramatic new way. And it's working. Whether it be cancer, arthritis, heart disease, we can personalize treatment like never before.
Will I be able to understand or to know what diet is best for me finally, rather than, all this changing science all the time? Will they be able to tell us things like that?
The hard part about diet is much of what you do in diet is going to affect you a decade from now or 2 decades from now. So there's a lag time. It's very hard. Mark Twain said the amazing quote, right? The only way you keep your health is eat what you don't want, drink what you don't like, and do what you'd rather not. And so, the argument really is that if you want to know if tomatoes are good for you, eat a diet in tomatoes, you're not going to know for decades. Did I get heart disease? Did I get cancer? So it's very hard. All of a sudden, though, technology is going to come through. Now you can detect through the skin changes in insulin and sugar. And pretty soon you're going to have watches that tell you that. And you're going to start to see, hey, when I eat this, my insulin goes through the roof. So let me eat carbs in combination with protein and it goes this high. And you'll be able to start to personalize things based on a real immediate feedback loop. We've never had that before. And so it's very exciting to be able to use technology to actually change behavior. It's very hard if I tell you, Jessica, I want you to do this or this. You kind of roll your eyes at me because you're not going to feel differently and you're not going to know. 10, 20 years, forget it. That's the hardest thing with health. There's a lag time. But when we have technology to give us immediate feedback loops, it's going to change like this. You look at something, meditation works because you feel better right afterwards, right? There's no question about it. You feel better. Eating good food doesn't necessarily make you feel better right away. But if we start to have these metrics, we're going to be able to change behavior and have a better long-term outcome.
That sounds very motivating. Sounds great. You mentioned that precision medicine isn't so precise. What did you mean by that?
Many times we overuse our technology. Google did an amazing thing is they bought the ancestry.com data set, and in it they had about 100,000 individuals who were genotyped. They looked at their DNA and they started to try to identify the gene for longevity, and they searched and what they found was shocking. I could tell how long you're going to live more accurately by asking you how long your spouse's mother lived than by sequencing your whole genome. Turns out genetics are only 4 to 5% of longevity. The other is behavior. And you marry people of similar behavior and they inherit their behaviors, or they do the same behaviors classically as their parents. So if your parents hated doctors and medicine and didn't do the right thing, likelihood is you probably behave the same and you'll marry somebody of similar traits. So by looking at your spouse's mother correlates more to longevity than sequencing your whole genome. So sometimes we overthink them. Genetics are a code. If I had a car, I took about every piece. It doesn't tell you how long it takes to get from Aspen to Denver. You forgot the bladder size of the driver, the weather, the traffic. They all matter. In medicine, many times we just keep taking apart the car and looking at the pieces, but we forget that complex system that Murray Gell-Mann was so beautifully talking about.
Well, that's an excellent perspective. We do hear an awful lot about genes, and that is part of what you are talking about for the future. So is it always good to know what our genes say about our future? What about the things that we learn about that we can't do anything about? Or, as you mentioned, may not be completely accurate because genes aren't the whole story. My husband recently received a test kit from his son to test his genes. And I suggested that he do the test for the ancestral information, but not do the information for the diseases he may be at risk for. So I question whether we really want to know we have a 20% higher risk of something that there's nothing you can do about. And besides, you don't even know if you're going to get it, and you might worry a lot about it. But how much do we want to know from our genes, and how helpful will it be?
It's a great question. I mean, there's no right answer to it, obviously. And it really depends on your own value system. To me, knowledge is power and knowledge is important. So, when I launched the first kit where you spit into a tube, we sequenced your DNA and we'll say it'll happen. And so we had a woman on the TV show Nightline, and she and I were on, And she was a remarkable woman whose husband had early onset Alzheimer's. And he was one of the heads of the NIH. And live on TV, we gave her results, and she was high risk for Alzheimer's. She had about a 70% chance in her lifetime of Alzheimer's based on her genetics. And she was a hero. She said, listen, I'm going to double my efforts to raise money. I'm going to do everything I can in prevention, even though it's not defined that these things will definitively work. I'm still going to be lean body mass and exercise, et cetera. I'm going to be an advocate. I'm going to push Congress. I am empowered. And that was beautiful. If you look at the NIH Reveal study, which actually looking at the ApoE4, the gene risk for Alzheimer's, it showed that, anybody, these are family history. So most people, when they take this test, they know mom had Alzheimer's. So therefore, I'm probably high likelihood. It's always in the back of your mind. And actually having the information can spur behavior change, can spur early detection, can spur you being an advocate. And I love those aspects. It's not right for everybody. It may keep you up all night, every night. But if you look at the Reveal study, in general, people had a positive outcome because they always thought they were likely to get these diseases, and knowing information, either yes or no, actually encouraged them to action in a positive way. So I'm a believer in it, but you're right, it's one piece of the puzzle. It's the instruction manual. What's happening a moment in time are newer technologies. It's metabolomics, it's microbiomics, it's proteomics, all exciting and encouraging and all new sciences, but pretty soon we're going to know a lot more. And to me, it's critical to know that information and, and to focus on the preventive side, which obviously you specialize in, because it's a lot easier to prevent something than it is to treat it.
So true. Well, it's hard to motivate people sometimes, and that's part of what you're talking about there with understanding your genes. But we've known for a long time that in order to improve our health, we should sleep 7 to 8 hours. We should exercise regularly. We should not sit too long. We shouldn't drink too much. We should eat a nutritious diet, but not too much food. And as you remind us, maintain our muscular strength and control our levels of stress. So the problem is that people can't do it usually. So how is technology going to make a big difference in our personal behaviors and sometimes our what can be subconscious decisions about what we do and what we don't do? Now, you just described one thing where sort of seeing into your future may help motivate people. But for most of us, what is going to keep us day in and day out, year in and year out, motivated and remembering what's really important?
And the beauty of technology now is it can start to measure things. And we all think we sleep enough, or we think we don't sleep enough. And nowadays, I'm one of those geeks that has a pad under my mattress. So it's under my mattress. I don't feel it. And every morning I can look on my cell phone and see how I slept. And I start to see my own correlations. I know alcohol isn't good for sleep, right? It's a depressant. So you fall asleep, then 3 or 4 hours later, you get a rebound surge in adrenaline and you wake up. But when I actually see, listen, I know, and I hate to say this to Jerry Murdock, when I have more than 2 glasses of wine, I don't sleep well. And I can see this, right away, and it actually changed my behavior. I have a feedback loop there. And so, I thought I walked a lot more than I did. And now I can look at these devices and say, hey, I really haven't moved. And the period between 2 o'clock to 6 o'clock, I was just sitting at my desk. I need to get up and walk around and be reminded to do so. So having a feedback loop is critical. And again, we're going to start to have it with what we eat, how we behave. And, to me, that's encouraging and exciting. My kids, are classic, 20-year-olds who think they're impervious to everything, but they have the same device under their bed. And they realize that when they use their iPads at night, they weren't sleeping as deeply. So now both of my kids, they wear those glasses that have the yellow lens and it blocks the blue light. And they know they get more deep sleep and it changed their behavior. So they had a feedback loop that was powerful. And more, we're going to be able to do that. I'm in our new institute that literally just opened last week. And again, that came from that discussion with Murray about multiple disciplines working together. So we have an institute where the physicists and mathematicians and engineers all work in one place to understand the human body and cancer and disease. But every person who comes in gets a bracelet, and it's a 5G enabled site. So I can look at who interacted with who. I can look at how much they moved around. If they're not interacting, I could change the layout. So all of a sudden I have a building that can give a feedback loop and I can know what's happening. So instead of, me just saying, well, it's important everybody talk to each other, I can actually see is did they? I could start to look and say, was it efficient how my nurse did things or not? And I could change how they do things. Those feedback loops are going to be pretty soon in our house. We're going to start to see when we're sedentary, when we move, and that data is going to empower us. if you walk an extra hour a week, you live longer. The data are very clear. And so we need technology to enable us. And you hate to say that, we should all know what to do, but having built-in feedback loops for technology to me is empowering.
And then we have to stick with it and not get
Yeah.
bored. I like the idea of your bracelets for contact tracing in case anyone develops COVID. You can use that. That would be helpful. So how do you advise us as a society as we face unequal access to these technologies that might create an even bigger gap between the wealthy and the poor? People in certain zip codes live 20 years longer than people in other zip codes, and they may only be a few miles away. So how do we address that as these technologies grow?
Exciting thing to me is that these technologies, I think, are going to be great equalizers. They're actually going to bring us all together. And most of the technologies we're talking about are rather inexpensive and actually can be accessible to almost everyone. And many of them are actually showing, monitoring glucose. Well, now third-party payers, insurance companies are buying it for patients because they monitor keep their glucose better under control. They get hospitalized less and it costs less money. So the power is when you look at value-based care, which is where the mantra, where everything is going now, these actually are valuable and they actually add to care in a cost-effective manner. And so I think they're going to be very accessible to everybody. And it's going to be a new era where technology is actually going to lower the cost of healthcare. If we prevent hospitalizations, healthcare costs go down dramatically. And I think technology is going to enable that. So we're very cautious in pushing for technologies, coming down in price, and they are. You're going to start to see a revolution in low-cost technologies. You're going to see many of the lower-cost stores being places of healthcare access. Right now, you need to go to a doctor's office, and it's very inefficient, and it costs a lot, and there are a lot of barriers. Very soon, you're going to be able to have your blood drawn by a prick of the finger anywhere, and you may be able to just teleconference with the doc. So much cheaper, easier, accessible to more people. And obviously, when you're living in a rural community, that changes everything because you can access experts everywhere. So telemedicine and these technologies to enable point of care, I think are going to be transforming.
So we see you on the news addressing the pandemic, and we thank you for helping manage this and address all these concerns that really we're in the midst of now. So briefly, tell us why our country seems to be failing in managing this. We were talking about this a little bit before we started. Compared to many countries, what are the things that we should have been doing differently and we should do differently?
Obviously, this is a new time in the world, and it's a staggering moment in history that we will all remember. Throughout a million years of human evolution, our genome evolved 1%. This virus can change 1% in a day. And so the power of the virus is profound. Josh Lederberg, one of the great Nobel laureates, said in the mid-1990s, the only thing that will challenge man and woman's dominance on the earth is the virus. It is our wits, our brains versus their genome. And it was a very prescient statement, but very powerful. And so historically, most of the viruses we've seen were from livestock, right? The whites brought it to America, and the Indians, many of them died, from the viruses that horses and cows brought. This is a new era because of climate change, because of urbanization, because of us encroaching on the natural environment. We are for the first time seeing viruses from the wild. And this is a new era. And this era is only going to grow and continue. So we have to learn from what's happened now. Early on, the United States failed because we have very poor testing. We thought we could make a test. There was a lot of nationalism. It has to be our test. And it didn't work. So the virus was given an 8-week head start. And unfortunately, viruses grow, exponentially. They don't grow linearly. And so with an exponential 8-week head start, the virus was all over. And this virus is different than almost every other virus we've seen because 50% of people are asymptomatic. Asymptomatic people mean well, don't realize they're sick, and go out, and they can spread the virus. And most people, most viruses, the flu, by the time you're symptomatic, that's when you start to be infectious. This virus, even if you become symptomatic, pre-symptomatic, a couple days before, you were infectious. So everybody really can spread the virus without knowing it. And that's enabled crazy spread across the country of this virus. There is a technology that will work and will actually stop spread of the virus. If we all did it in the country over the next 3 weeks, there will be no virus left. It's called wearing a mask. But to normalize that behavior, to normalize any behavior, you need leadership. And right now, and really throughout the last several decades, we have very little healthcare leadership. We just don't put people in that position historically. And certainly now there isn't leadership that is really pushing people to do this simple behavior change. In countries where it's been normalized, in the Asian countries, when you're sick, you wear a mask because you realize that you don't want to spread it to others. It's a sign of respect. In our country, that has not been normalized. So in South Korea, in Japan, in China, they've told people, listen, we want everyone to wear a mask. And because that behavior has already been normalized, it hasn't been difficult, and they've done very well. And they've been able to get over their first wave, and they have very small numbers of cases. In our country, we're still not over the first wave. We are the only country that I am aware of with a Bill of Rights. We have a right to do what we want. All of us can do everything. Our personal choice is to do that. But when your personal choice affects the health of others, that's where we have to draw the line. We had enabled people to stop smoking because we said, hey, listen, secondhand smoke kills. Before that argument, right, you had a right to smoke. It was your born right to be able to smoke and do whatever you wanted to your own health in that regard. But when it affected others people's health, that's where we drew the line. And we have to do the same here. Behavior, not wearing a mask, in the future, not getting a vaccine, will enable and dramatically affect the health lives of others. And that's something that we can't tolerate in this country, and we have to stand up. This virus discriminates, right? It hits people of certain races, of certain ages, with medical conditions, and we can't help them. And we have to stand up, us as a collective society, and help each other. We have to be one community. But it's very hard to tell, in the first inning, we got it. You had to stay at home. But this is the second inning. And how do you tell people how to behave when behavior is different depending on who you hear from and depending on where you live and what TV channel you watch? The results are different of what we should be doing. And there isn't a uniform a spokesperson on this. And that's very difficult. And especially the younger generation are saying, listen, everybody's saying different things. I want to do what's easy because I'm going to be okay. And they're right. 20, 30-year-olds, the chance of them being hospitalized is near zero. But we have to make them change their behavior because they can spread to others. And that's just unacceptable.
I hear you about the leadership, and I think that you spell out exactly what we need to do. What are some of the things that we can do in addition to what you've mentioned about attitudes and politics and feelings about freedom? There's a distrust of science and evidence and data that is very alarming. So how do we start to turn that around, given that we're not going to probably change leadership immediately? How can we use other?
I don't, obviously our government has not had a great response, but our whole country hasn't had a good response. Remember, our secret sauce in our country, don't tell anybody, but it's our science, right? In our science labs. Most universities in the country closed every lab. So we had our secret sauce that could have gotten our way out of it, and we closed the labs. So this isn't our government doing this. This is every major university in the country. You have a university in England, a university that survived the plague, a university that was formed in 1046 that has developed a vaccine that turns out to be the leading candidate. So it wasn't the techiest university in the United States with all the greatest endowment. It was one of the oldest universities in the world with the least technology, has developed what is now the lead candidate for a vaccine. And science will win. There is no question about it. I see it. I'm on calls every day with what's happening on the vaccine front and the therapy front. And there's a new class of therapy called monoclonal antibodies. If I gave Jessica, you the virus, not on purpose, I just happened to sneeze on you, I could then take some of the cells out of your bone marrow, and some of those B cells would be making antibodies that would neutralize the virus. So not any antibodies, but antibodies that block the virus from doing its thing. And I could take those B cells, grow them up, and make vats of this, which is what's called a monoclonal antibody. And I could give it to someone who had the virus, and it will stop the virus cold in its tracks. I could give it to you, and you could kiss somebody with the virus, and you won't get the virus. So it could be preventive or treatment. So there are half a dozen of those in development, and they all look encouraging. And there are now 5 excellent vaccine candidates in development. There are 160 in development, but 5 look fantastic. And our government, to its credit, is doing what is called at-risk manufacturing. They are making hundreds of millions of doses of each in case they work. We got lucky with one of them in that 2 philanthropists in Brazil funded a trial with the Oxford vaccine, and Brazil Turned out that it just took off a number of cases. So you need a lot of cases in an area where you're testing a vaccine to show it worked, and you'll know much quicker. We're also going to see the results of what we call challenge trials. So challenge trials are remarkable, but scary. And so they're going to do two of them. One is people who've had the virus, they're going to give them the virus again. They're going to put them in a hotel, secluded from the rest of the people. And this will be done in the UK. And see what is real immunity. They're going to define what immunity is. And then in another group, they're going to give them a vaccine and then give them the virus to see if it works. And so those will be started soon. And we're going to see real science and start to understand it. But we have to change the attitude towards science. We have to make people comfortable with this. This Oxford vaccine has been in development a decade and has been tried in close to 14,000 people already. It is safe. There's yet to be one. There are zero, so not yet one significant adverse event, which is really encouraging and exciting. And they're excellent immune responses. So in my mind, it will work. The question is, how well will it work and how long it will work? And that we'll figure out. It's not going to be one and done. The initial vaccines will be 2 shots, and then there'll be booster shots later on, depending on how old you are, what your immune system is like. And so we'll have to develop ways to test and to do that. So it will be a new world, but it will be a world, again, where we can go back to a new normal and a better quality of life than we're all doing now, secluded in our homes and zooming in 2 dimensions.
Right. Well, I mean, I think that sounds very hopeful and promising, and I think that's right. But I think the vaccine could be a ways off. What do you think? Before we actually have it available for a lot of people.
I
And
think it's going to be this fall. I think it's going to be this fall. Yeah.
For people in general.
We're going to start off with frontline workers and higher risk individuals, and then we'll scale to the others. So it'll be available this fall. It'll probably take 3 to 6 months to vaccinate and make it available to the majority of the country. But yeah, no, we're going to have hundreds of millions of doses in the fall. And the data, fingers crossed. I mean, believe me, I'm a believer in the superstitious gods. The data look encouraging. I think it's going to work. So I am optimistic. And if we have therapies like monoclonal antibodies that work, we have vaccines, even if we haven't vaccinated everybody yet, our shoulders come down. And we need to get our kids into school in the fall. We just need to. We have to figure out a way to change behavior, bring down the incidence of virus in this country, and do things right. Yesterday, we launched, this is the first time we're doing cloud-based enrollment for a phase 3 trial in the world. We launched it here yesterday in the United States. And without any media will start next week. Without any media, we've already had over 50,000 people sign up to be part of those trials. And so the American people are responding. They will say, we're going to fight this together, just like we did in our world wars. We're going to get together, and together we will make a difference. And they already are. I was astounded. We expected hundreds and we got tens of thousands. And it just launched yesterday at 10 a.m. So it's pretty wild, and people are stepping up. And as the media come out over the next week or so, we're going to hit over 1 million, and we're going to have people ready and are volunteering saying, I want to be part of the solution. So I'm proud of the country in that regard. Science will win, and we will all be part of that solution.
I hear you say that not everyone will get vaccinated, and I think we know that's true, but it seems like there's a growing sentiment of anti-vaxxers. And I'm concerned about how many people that may envelop, and at least discourage enough to say, well, I don't really need to get it. Could that be a problem?
Could that be a problem? I've already had 3 individuals who have threatened my life. And 2 of them actually tried to take action because we talk about vaccines. So it is a religious phenomenon. It's not science. It's not fact-based. It's religion. And yeah, it scares me tremendously. What we're going to see, though, is that you have a right not to be vaccinated, but you don't have a right to travel state to state without a vaccine. You don't have a right to go to certain events without a vaccine, because you don't have a right to harm others, just like you don't have a right to smoke in a restaurant. And I think we're going to start to hopefully see things like that, where yes, you don't have to take a vaccine, but you don't have a right to really challenge the health of others, because there will be many people in our country, very young people, very old people, people with other medical conditions, who will not respond to the vaccine. So if we have a cohort of people who can spread the virus, we can kill them, and we don't want that. And so we all have to step up for others and look at the data and be really aware of it and start to talk science. We need leadership in science. And it's something that, has to change. We have to step up. I've put myself in a lot of uncomfortable situations over the last several months because we're forced to step up. Things have become politicized, whether it be drugs, whether it be vaccines, and that's just not right. There are no politics about science and disease, and we have to rise above that. It doesn't matter what party you are, how rich you are, what your beliefs are. These viruses can attack all of us. Diseases can attack all of us, and we have to rise above it and rise above it with real fact and real science. And that's what's scary. And listen, I get it. It's been very scary to the public because science has changed. Our understanding of this virus has literally changed on a weekly basis because this is all new. And when people see the science changing and the World Health Organization changing their opinion on certain things, like, oh my gosh, the science isn't right. Not the fact that science is iterating and learning as we go. We've never been transparent like this before and as vulnerable like this before as a field. And we have to not shy away from that vulnerability, but take it head on and explain, and really get out there and talk and explain. My life changed, in the 90s, where I was sitting in my lab at Sloan Kettering, and then there's a knock at the door. And I look up and I go, oh my gosh, it was the man that year had been Time Man of the Year. And I never met him, but he was knocking on my lab door. A guy named Andy Grove. He was the CEO of a company called Intel at the time. And he came into my lab and he started to talk to me. And he said, listen, David, he had this Hungarian accent, which I can't even do. But he goes, David, and this is my attempt. I like your science, but you're a horrible public speaker. It's your job to educate too. I go, no. I just need to do science. He goes, no, you don't. And he scheduled literally, several hundred talks for me where I would, on the way home from work, stop somewhere and have to give a lecture all over New York City. I was at Sloan Kettering at the time. And he forced me to be able to explain things to all different audiences and really changed my life and really showed me that part of my role is not just to do science, but is to explain science and be able to talk to people. And that the real challenge is to be able to do both, because one without the other has very little power. And Andy was one of those people that just did it. I mean, he didn't ask me. He just sent me, it was faxes back then. Half the audience probably didn't even know what a fax is. But we would get a piece of paper that told us where to show up. He just did it. And that was the personality he was. And it really changed my life in a positive way.
Well, you say it so well. I wish we could spread you out all over and have you speak to everyone, because I think it would make a big difference. Just listening to you about the vaccine issues, do you envision there could be an immunity certificate or passport or something? Is that what you're sort of saying? So that it would be dependent on us having some proof of some type of immunity that we could go mingle with people and travel.
We'll have that. I mean, we're going to start to see it in other parts of the world before the United States. And, I'm part of a team that's been working on such a thing. And yeah, we have to have that. If you're from one country and the other country say, I don't want people who can potentially spread a virus coming to my country. And there will be restrictions in that regard. And we're going to, have to the first time share healthcare data. That's a novel thing. It'll be de-identified. It may be tied to your, license in many respects. It's not going to be shared with your employer, but it's very important that we respect the fact that these viruses are easy to spread, and we're living in a new world, and a world that is going to see, infectious disease being a dominant area that will shorten people's lives, and we can't accept that. We really can't accept that, and we have to fight back, and we're going to fight back through technology, through data, and through science, and we will win in the end, but we have to fight back.
Very good. So in the remaining few minutes before we move over to questions, I'd like to ask you, what are some of the most exciting and promising developments on the horizon for extending the length and the quality of our life? What are some things we might not know much about yet?
Yeah, listen, one came out today, which is the coolest. It was shown back in the 1950s, this woman named Wanda Ruth Lunsford, took an old mouse and a young mouse. So she tied their skin together, and then she looked several weeks later, and the old mouse, the gray hairs had turned brown again. The heart beat stronger. The muscles were bigger. She claimed she reversed aging. Well, they literally kicked her out of science. Well, several years ago, groups at Harvard, UCSF, and Stanford repeated Wanda's experiment, and it worked. And just today, there was a researcher at UCSF that announced that he identified the protein that actually affects the brain and enables you not to lose cognitive function. It's the same protein that when you exercise goes up and helps the brain. That's why when you exercise, when kids exercise or adults exercise, cognitive function goes up. and he identified that individual protein. That doesn't mean that I could give it to you and you'll get smarter per se. I think the body's a little bit more complex like that, but it is amazing to know we can start to understand the physiology of it and potentially optimize it. So what, it doesn't mean you're gonna be able to sit in your chair and not exercise anymore when we give you a shot, but it does mean that we're gonna have better science, particularly with regard to cognitive decline. Just a few hours ago, I saw a patient, and she was diagnosed with breast cancer. When she came in, it had spread to her brain and literally was coming through her skin. She thought she had an infection. It was breast cancer coming through her skin. We had given her chemotherapy and she failed. And so we were lucky in that we were able to give her immunotherapy. We gave her a drug that blocked the don't eat me signal on her cancer. And she had just come back from touring and she's now singing. She had been traveling and singing. Now she's singing on Zoom to clubs across the globe. But she's back to feeling normal, looking normal, and we can't see cancer on her scans. She's not cured, but we bought her years of quality of life because with immunotherapy, there's amazing responses, but they last for many years. And so we can use the own immune system to attack cancer. And that's crazy powerful if you think about it. We're developing newer ways of visualizing things. A paper came out 2 weeks ago. It was so cool. Anesthesia comes from ether, right? They had the ether domes in the old days of surgery, and you would sniff ether and then they would do surgery. And that really enabled the whole field of surgery to happen and enabled us to live much longer because surgery can solve many problems that affect us. We never knew how anesthesia worked. And for the first time now through technology, we can visualize the cell membranes. They showed that it affected the proteins that were floating in the cell membrane and exactly how it worked through these new microscopes. And so the paper just came out several weeks ago, how anesthesia works. Amazing phenomenon if you think about it. We've been doing it for 100 years and we never knew how it worked and it just came out. So all these new technologies that enable us to visualize things at different scales, that enable us to make drugs literally overnight. In the old days, literally, it would take a half a dozen people to be able to make a drug to a target over a dozen years. And that would cost you millions and millions of dollars. Now, I can 3D model the drug, identify something that fits in where it will fit into a receptor, and then I could send that three-dimensional structure. President Trump won't like this, but I send it to Wuxi in China, and literally 3 weeks later, I get a vial back of the drug and I could test it. So in a matter of weeks, and it costs $25,000, I can have a candidate drug to hit a target. And a remarkable advance where it would literally take years and years and millions of dollars before. So we're in a new era in what I do. At the same time, we have to respect the fact that face-to-face interactions work. We have to respect the fact that this organ up here, we still have no idea how it really works. And it is pretty remarkable that our brain, which is what distinguishes us besides this opposable thumb, from most of the creatures on the earth, we have no idea how it works. And we still have yet to develop a technology to really visualize it functioning and know how to protect it and what to do. We have a lot of observations and we have to respect those with data. We know if you sleep well, this thing works better. We know if you exercise, this thing works better. We know if you meditate, this thing works better. But we don't know that much more. But we're going to be in a new era now because we now have these technologies that can see us on different scales. And it's going to be crazy exciting to be able to see it work.
Very exciting time to be alive and a lot's left to do. Let's move to audience questions. I'm sure there'll be quite a few. So I'll hand it over to Crystal.
Hi there. Yes, this is such a great discussion. Thanks to you both. We have a lot of great questions coming in. Our first question is, what data do we have in regards to antibody decay?
I assume you mean that the loss of antibodies over time in terms of immunity to COVID-19. So what's interesting is that many viruses, including this one, the dominant immune response is not antibody, but it's T cell. And if you look in the news, there was an article that came out that after 2-3 months, we start to lose the antibodies that provide immunity. And that's very true, but we have never measured the T cells in those patients. And so most of the immunity to this virus is T cell mediated. We're seeing that with the vaccines. The problem is to do a T cell assay to quantify T cells takes a couple of days, and it's really difficult and scalable. So we and others are trying to work at quicker ways using technology to measure these T cells and these T cell responses, because that's going to be the secret sauce for immunity is T cells. And T cells have a memory, they last a long time. And if we can optimize for these T cells, we're going to do much better with these vaccines. And so be cautious about what you read about antibodies. Be cautious about the antibody tests out there. Most of them measure general antibodies. They don't measure antibodies that actually turn off the virus. And again, it's only measuring one part, and it's really a minority part of the immune response, the antibody response. So that's one of the things that's been a lot of hype by the media about these antibodies, but it's only a tiny piece to the puzzle.
Great. Our next question is, I heard recently that masks are much more effective than something like a bandana or a scarf. Can you explain why that is? Aren't they essentially doing the same thing?
Yes, I was looking for my mask. So, what happens is every time you speak, about 40 to 50 droplets come out. Every time you breathe and you speak, you scream, more droplets come out. You cough or sneeze, even more come out. But 40 or 50, it takes about 1,000 or so to spread the virus. So this is a virus that it's not as easy to spread as you think. If there's a dinner party of 10 people around a table, and Crystal, you have COVID-19, only the 2 people at a 90-minute dinner party, either side of you will get sick. The others classically won't. So you need to have close contact with somebody for a prolonged period of time to give enough of a virus to them in order for them to get sick. So normally out of doors, there's enough ventilation, UV light of the sun degrades the virus. Indoors or close contact, you wear this mask, you wear a bandana, you wear anything that covers your face, you will block dramatically droplet spread. So obviously, if you wear a 2-ply thing, it's more. If you wear an N95, it's even more. The harder is, the more layers there are, the harder it is to breathe. And if you want to wear it for long periods of time, you need to be able to breathe. So you need a good fit around you. I had to buy a half a dozen before I have a weird shaped face, unfortunately, or fortunately, it just makes me unique. But I had to buy a half a dozen before I found one that fit me really well. And I got a bunch of them. I wash them every night, and that's the ones I wear. And then in the hospital, I just wear the disposable hospital mask. But we all need to do it and really do our part and step up and do that. As much as possible, have interactions with them. Listen, we have COVID-19 dinner parties. We sit at separate tables, 6 feet apart. We wear masks when we are out there. We take them off when we eat dinner. We're sitting apart. We all have our own food on our table. And I'm able to socialize with friends. So you can do things safely. You just have to think and do it right. And we have to step up as a country. And there's light at the end of the tunnel. I really believe in the next several months, we're going to have treatments and vaccines. If we do it for the next 3-4 months, there's light at the end of the tunnel.
In transmission, do you believe in super spreaders? Do you think that 20% of people may be spreading 80% of the infection?
So the idea of a super spreader is, for some reason, the physiology of some people is they spray more, and we've seen it, right? Some people, you're wet after you talk to them, right? We all know those people, we've met them. So there's no question, some people have more droplets than others. People who are symptomatic have more viral load than others, so they can spread more. And those are what we call super spreaders. They're certainly real. We have no idea how to quantify that, Gilly. Everything else is really estimates. You see a lot of these crazy modelers out there, and the models change all the time because they're exactly that, they're models, and there's not a lot of data. I can't measure well infectivity. That's a problem, right? If I can't measure it well, it's really going to be hard for me to model it, get data on it, and know it. And so it's really a lot of just anecdotal data. Listen, I was in my house except for this one time, and this is what happened. Well, that's how you must have caught it. So that must be how the virus spreads. Believe it or not, that's a lot of what we know today.
So our next question is, I read today that US officials are debating giving early access to the vaccine to communities of color that are facing the highest risk. What are your thoughts on that? Can you speak to why Black communities, for example, are at higher risk?
So 2 separate questions. So one is, yes, the CDC did have a meeting where they talked about how to put a hierarchy to who gets the vaccine. As you can imagine, doing that is going to be chaotic in our country. Even just administering a vaccine to hundreds of millions of people is going to be chaotic. Can you imagine if we have to start to decide, well, we need to give it to you, and then you, and well, you lost 10 pounds, so you're no longer high risk, so just come back in a month, et cetera. It's going to be very difficult. So there's a lot of talk about that. There are certainly no decisions made at all. But what we do know is that certain races, African Americans, dramatically higher symptomatic rate from getting the virus, not incidence, but symptomatic rate once you have it. People of Asian descent, higher symptomatic rate than Caucasians. People of Spanish descent, higher symptomatic rate than Caucasians. The answer as to why is we have no idea. So people say, well, it's a social determinant of health. We don't have a lot of data on that per se. And it certainly may be the case. Well, they live in areas where there's higher particulate matter, so they have more inflammation in their lung. Again, a hypothesis. We don't have data of not knowing it. For all we know, it may be genetic, right? They may be more genetically susceptible to getting inflammation in the lung, which is symptomatology, when they get a viral infection. The real answer is we don't know why, but it's real, and we have to address it. And so vulnerable populations need to be vaccinated first. Caveat is if they respond well to the vaccination. So what's happening now is we're taking people of different races, different ages, different weights, different medical conditions. We're giving them vaccines in the trial, and we're starting to catalog. If your 90-year-olds don't respond well to vaccine because their immune system doesn't, we probably shouldn't be giving them a lot of the vaccine doses early on because they're not going to respond. We should be giving it to others who may spread to them. And so we don't yet know until we have all of that data, and that's all going to come in over the next 6 to 8 weeks. So it's all being collected now. We've started to see good pockets of it from some of the studies that were done in Europe and some very large studies done there. We're starting to see pockets of the data from Asia and from Brazil and Russia. And that's going to enable us to figure out who to give first. But understanding, and all of these are clues. This is the coolest, it's actually the saddest, is about 15 years ago, I did the first study ever of a molecular targeted drug for cancer. And it was me and a woman at Sloan Kettering. And there were 100 patients in the trial. We each did half. And almost all the responders, 14 of them were my patients, and she had one. And so everyone said, Agus must be exaggerating the response. He doesn't know how to read the scans or whatever. And then, we were too stupid to realize that if you're an Asian non-smoking woman with lung cancer, you had a dramatic response to this drug. If we had realized that, we could have got it approved to them and saved many lives earlier. I live in LA, so my patients were a lot of Asian non-smoking women. They didn't have them in New York City where the other doctor was. And, the biology was different of the disease in those different people. We all are a different complex system. And if we had realized that, literally, we could have gotten the drug on the market several years earlier. We could have been a lot smarter, but we weren't. And so this is a clue about African Americans, about the different symptomatology of this disease. We just don't know what it means yet.
Thank you. Our next question is, how can we sign up to be part of this study?
I can give you, Crystal, the link. There's a link to the NIH where the database resides where you can, I would love it if you signed up and were volunteers, because we need people of every age, race, sex, you name it. We need them all because we have to see who it works in and how it works. So I will give you that link, and this will be the link, the same link for all of the phase 3 clinical trials of the vaccine.
Great, thank you. Next question, what is the best path toward providing leadership to combat this virus, whether that's at the state or federal level?
It's very interesting is that our government decided, let's let every local government decide their own rules. And it makes it very, very difficult. I understand the reasons. They're different incidents. Some states have very little virus. Other states have a tremendous amount of virus. The rules can't be the same in both. But it's very hard when you take a state that has a health commissioner that has very little training or background, and you enable them to make decisions that affect lots of people's lives, where somebody can be tremendously qualified in a different state, and they're not equal. And so that's difficult. Classically, the CDC has provided this leadership. The CDC has not provided the leadership really for the last, and I shouldn't say this publicly, but for the last big viral outbreaks in our country, they haven't provided the leadership that I hope they would. And so I think we need to really develop new structures for leadership around this in our country. We're at war. This is a war on our own soil, and we are losing lives because we don't have the leadership we need. And so we need to step it up, and not just here, but globally. Infectious disease is a global problem. The world is flat. Tom Friedman, obviously, who's on your stage, very frequently wrote this remarkable, books about how the world is flat and things have changed. Well, it's changed in infectious disease because anybody from Wuhan can get on a plane and arrive in New York City very quickly, and things can change literally overnight. And we're starting to see that all across the globe. So this is really global. And the WHO, the World Health Organization, has not done what it's needed to do over the last really decade or more in terms of global health. They're good at responding to emergencies, but they haven't provided leadership for how we as a globe prepare for what's going on. And I think there needs to be new governance on a global basis. And so I know that's a lot of the meetings we're at now is how do we do that? How do we really provide leadership on a global basis around what's right and what's true north for what to do?
Great, thank you. Our next question is, what are some of the flagship projects you'll be working on at your new Ellison Institute, and how can interdisciplinary collaborations advance the work?
What's kind of sad, right, is that, my field, I'm a cancer doc by trade, and almost by definition, I have failed because people are still dying of this horrible disease, cancer. So, the notion that Murray gave me, spawned off by Walter Isaacson and Jerry, who introduced me to Murray, is that different disciplines give different ways of approaching data and thinking about things. So the way we've designed our institute, it's so cool. I don't know if you could see it. I mean, but this is, we've got a deck here. We've got green and trees and art. We have art like you wouldn't believe. People are loaning us art. And it all has a meaning. I wrote that elephants don't get cancer. So somebody just loaned me a Jeff Koons 20-foot tall elephant that's in one of the lobbies. And it's the coolest thing to be able to use this to explain it to people. Every wall is glass. So kids will go on tours and learn and be excited and want to grow up because, unfortunately, Jessica and I are not going to be the ones who solve the problems of the future. The next generation will. We need them to go into science or we're in trouble. But the whole premise was that different disciplines are going to give different insights and we have to work together. So we bought an apartment building next door and we have physicists, mathematicians, engineers from across the globe who've signed up to really work with us and come here and stay here. If you tell someone, hey, listen, it's exactly the same in Aspen, is I tell someone, hey, listen, you want to spend 6 months in Santa Monica? They all say yes. And it's the same thing, obviously true is when you say to me, you want to come to Aspen Ideas? I go, hell yes, because it's such a remarkable place. And, I want their brains to help us. These amazing scientists have been working on their problems. Well, you tell a mathematician, you tell her, and I say, hey, listen, I'd love you to work on modeling disease for the next 3 months. And she goes, of course, I'd be privileged to have my work help people and have meaning today rather than doing something that may have meaning decades from now. And so they're signing up, amazing scientists from across the globe to help us think differently and model differently. And so any of you, we'd love to have you by when you're in LA, give you tours of it. We have a history of medicine museum because I want people to realize that we're not saying screw the past, we're building on the past. And I want you to be able to see it and enjoy it. And we have the clinics there. We have a wellness clinic and we have a cancer clinic. It's very important to me that we have both because they're a continuum. It's very hard to understand what peace is until you go to war. And so when you put the two together, they're much more powerful than either one alone.
That's great, thank you. Our next question is, what are your thoughts on Trump deciding to leave the World Health Organization?
It's awkward for me because really for the last decade, every year we go to the World Economic Forum in Davos, and I've been a very vocal person that I think that the World Health Organization has seen its time. That being said, this was not the time to leave it. And so we need new global governance in health. Technology advances are literally happening day by day. We now can use CRISPR to edit one of the 3 billion letters of DNA code, get rid of DNAs. We can use the immune system to fight cancer. We can use stem cells. We can use proteins to prevent aging. So we need ethical leadership. We need moral leadership. We need legal leadership. We need intellectual property leadership, and we need it done in real time. And I think that's really critical. Several years ago, the New York Times called me and they said, later today, Angelina Jolie is going to write a piece and it'll come out that where she announced she had a mutant gene for breast cancer. Will you write the companion piece? And I go, sure. When is it due? They said an hour. So I go, yes. So I wrote about that in the 90s. We were part of a team that identified this gene. It was done in the Mormons because the Mormons all wanted to be buried in their church and they couldn't fit. So they put a piece of them, their hair, and the history in the church. And that was a repository of DNA, and the gene for breast cancer was identified. It was licensed to a company, and they charged $5,600 for a woman to look at her own DNA, a ransom to look at her own DNA. And I called it predatory practice and monopolistic, that a woman had to pay a bounty to be able to look at her own DNA. Well, several months later, the Supreme Court then announced you can no longer patent a gene in our country, and they've democratized that technology. One of the justices called me and said, aren't you proud of us? And I said, I'm proud you did this, but it took you 12 years to do it. And in that interval, over 100,000 women died because they couldn't afford to look at their own DNA. And so we need to change that time scale. And so global governance is required and needed to be able to do that. And so we need new organizations that could do this. Because if we do it in the United States and not in Mexico, all you need to do is jump on a plane and go to Mexico, and you could have something that we don't allow here in the United States. So it really needs to be global in how we do this, whether it be planning for a pandemic, whether it be controlling or looking at technology and the ethical and appropriate use of them.
Great, thank you. This is our last question. Can you speak to the debate over spreading the virus by way of surfaces versus droplets?
Almost all of the spread in the globe is spread by droplets. There are very few, there are some, but very, very few documented cases of spread by fomites, which are viruses that are on surfaces. And so while it's important to clean things, it's important to wash your hands, wearing a mask is the dominant way we will stop spread of the virus. And it is the dominant way the virus is being spread is through droplets from person to person contact. Adult to adult contact, much easier to spread than child to adult or child to child. Children are about a third to a half less likely to spread the virus than adults are. And that obviously has to go into our policy and our way of thinking also.
Great, thank you. Dr. Agus, this has been so fantastic. Dr. Herstein, thank you so much for moderating. Thanks to our audience for all of the great questions and for participating. Again, you can text "sign me up" to Dr. Agus's text service. That's 310-299-9322. All of our community events this summer are free and open to the public. So if you are in a position to donate, please click on the link in the chat. I hope that you'll join us for all of our great events this summer. Next up on Tuesday, July 14th, we're featuring the McCloskey Speaker Series with Rachel Bidekoffer, Tamara Keith, and Dan Glickman, who will be discussing the 2020 election. Thank you for joining us. See you next time.